Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Malaysia's COVID-19 mortality rate increased to 0.86% in the past week, meaning that almost 1 in every 100 COVID cases in the past week had succumbed to the disease. Now, in the first 18 days of May alone, we had 500 reported deaths, the same number that we experienced for the whole of 2020. Now, are we headed for a quote-unquote vertical surge? And what consequences will this have for society and our health system? Dr. Mafeitzeral Mamat is an anaesthetist and critical care consultant at Gleneagles Medini, Johor. He joins us on the line now. Dr. Mafiz, thank you so much for joining us tonight. Now, the Director Health General, Dr. Nur Hisham Abdullah, has warned of this vertical surge, in his words, of the current COVID-19 epidemiological curve. Now, I'm just wondering what you understand the situations to be in hospitals at the moment.
All right. Thank you very much, Melissa. I think, it's of course, grave of concern. And if those who are watching closely the situation in the social media and what the Director General himself, Dr. Hisham, has been saying and portraying of how the healthcare in terms of the last line of defense. Yeah, we're talking about ICU beds. We're talking about the mortality, the death rates, and how the number of cases are increasing, and it becomes more exponential now. As we are aware regarding what we call the R0 number. Yeah, the number of about infectivity currently is one of its highest, is 1.2, and it's looking at we are not at our peak yet. Where we think death of about maybe 60 per day, which are being announced every day to be the last of it. Maybe not. We may be increasing as it is. And of course, the measures that we are doing now is to halt this rise and hope, as how the famous words that have been going on since last year, flattening the curve. And we are trying to flatten a very steep curve, which is going upwards at the moment. So yes, it is of a grave concern. My colleagues who are working all day, all night, whether from the public health side or the last line of defense, the emergency department, the ICU, are struggling. They are struggling. They are not like having their time of their life. And most of us are not prepared already. But we have to, and we have done so far. But the fatigue is there. And everybody's tired, and we are still doing our best, my colleagues. And right. I applaud that. And yep.
Yeah, Dr. Mafeitz, I want to ask you, we look at the problem, and since it's a global one, the death rate, at least as it was expressed last year, were quite relatively good compared to many countries. And we think of the mortality rates in countries in Western Europe, for instance, we're far behind some of the numbers there. But, in each of these contexts, there are reasons why people die and why certain types of people are dying, the demographics of it. What do you understand to be the main reasons people are dying? Is it the general lack of good health, or is it that we have an aging population that's much more vulnerable? What's your perspective on this?
All right. It is definitely a new type of disease that we are facing. Most of us do not know, especially last year, how it will turn out. And we have, in fact, what we based it on earlier was the previous SARS, because this is SARS-CoV-2, because it's about the same, the virus, but how it acts or how it kills people, like what we're talking about today, is totally somehow different of what we are used to or what we know. Yes, you are right. The last year, the main major population and how we could put it at risk are those who are elderly, and as well with lots of comorbids, which means that they have other diseases. Even in our statistics of our admission to Sungai Buloh, which was published, where we have this big population, and the risks are or the elderly ones, and these are the ones who are vulnerable. Hence, I guess the idea of trying to protect them in terms of our strategy for vaccination, etc. But as you can see, as 2021 looms and came, we were talking about the variant of interest that became variant of concern. the Brazil, the South African, the Indian. And I guess the one example that we take here is like India. What happened to India? India, relatively with the big number of population last year, was great. I mean, people would still argue that they are underreporting, etc. But what happened in the last month and how their surge became like almost 500,000 per day infected, and the death was alarmingly, nobody could really explain, saying it's the Indian crisis. And it's currently, you would see people flocking the emergency department, the ICU are the younger ones. That means the age between 40 to 60. Before the 60s, 80s, we get everybody to be infected, but those with the bad COVIDs are the elderly ones or who gets the complication. The younger ones tend to be even, 80% are said to be okay, yeah.
Right. Dr. Mafeitzeral, I'm curious to ask you about the number of people who have been brought in dead, or the BID cases. The number has been increasing, particularly in the Klang Valley. I'm wondering why people are dying at home. What are the reasons behind? What do we understand about these cases of people dying at home, not making it to hospital?
Okay. I think the situation, what is different from this year and last year, would be currently what we're having is this community spread, where we do not really know where the infection starts. Previously, we would presume in terms of the infection that starts of the symptom and how it worsens was within 5 to 7 days. Now it's maybe you are okay from day 0 to day 10. Even when you're tested, it can still be negative, but you become severe at day 12. In COVID, there are really 5 stages that we put them to be in their clinical condition. Stage 1, basically, they are asymptomatic, but they are positive. To stage 5, which is the worst, multi-organ failure, needing mechanical ventilation for oxygenation. So the deterioration you would expect from 1 to go to 5 as it progresses, because you can predict if you're in a cluster, you're able to contact trace, you would know exactly how many days you are in. Now you do not know. The one thing about COVID is you have what we call the happy hypoxics. What it means is, patient in any other disease that affects the lung, one of the first indication or symptom that you have is your shortness of breath, where you do not have enough oxygen, so the body reacts to tell yourself, okay, I don't have oxygen. But in COVID, a patient can be looks absolutely well, breathing well, no issues. But when you put the oxygen saturation on, they are already on stage 4, where they really need the oxygen, but they are not behaving as if they are. And this is where people may not be able to realize that. And by the time they feel the symptoms or their sign where they have the shortness of breath, and that is the time of stage 4. And that is when the deterioration can be really steep downwards, and you arrive or you are dead before you arrive in the hospital. So these are the particular point now in the community spread. And hence, the strategy now, even though there are arguments against lockdown, etc., but yes, self-lockdown is most important, is our responsibility. What I think people do not really realize is we are the ones who are bringing the virus around. The virus doesn't move. It's a human-to-human transmission. That means it's our droplets. That's why we wear masks. We protect ourselves, the healthcare worker, the PPE. Yeah, but we have, and the worst is when you are asymptomatic, you don't have symptoms, you are very infective, and you go and meet all around, and that's where it spreads, and you do not know at what day you actually contracted it. And maybe when you get the symptom, the shortness of breath, or the really bad signs of that, it's already too late, and that's one of the reasons why people are appearing late in emergency department, and basically it's like almost the end stage. Yep.
Right. And Dr. Mafeitzeral, is it still true, though, that those younger cohort of people who are getting severe COVID, the 40 to 60-year-olds, are still largely people with serious comorbidities, and that somehow it reflects the situation of Malaysia's population's health? We have like the highest rates of diabetes in the region, for instance. Is that what is really underscoring this picture, that we've come into this pandemic with poor health?
Yep. Okay. That would actually explain in terms of for example, we already have a number, the total number of 1,300 ICU beds. Previously, it's like about 800, and these 800 beds are filled with all type of patients every time. Hence, once this patient age 40 to 60 who are with the comorbids, yeah, they are at higher risk. And yes, it shows as well where we would expect those who have these comorbids, even at this age, to be able not to fend themselves against the COVID-19 infection. One of the things that happens is what COVID-19 does is purely in terms of what we call this, the oxygenation level of the person. And with all these diseases on board, it fastens, it hastens the complications that can come in. Yeah, and it is a risk factor. Example, in India, currently, because of their COVID-19 surge and with all the treatment, etc., we are seeing this, what we call the black fungus syndrome, which is going on. And it is related to patients in the Indian population who are diabetic, as well as other reasons as well. So it's an interesting perspective of what COVID-19 has brought in and exposed the other health issues that probably is in the population.
Right. Dr. Mafiz, today the Health Minister, Dr. Adam Baba, he said that if the COVID-19 crisis worsens in Malaysia, that we could come to a situation where severe COVID-19 cases may be transferred from critical care to end-of-life care. Could you explain to us what that means? What would that look like?
Okay. If we are to arrive at that stage, it means that it is totally overwhelmed, and what we concentrate is actually on this particular one disease. At this current moment, we already have 726 today in ICU out of the 850 pure COVID bed that we provide. Total is about 1,300. So if we arrive at the stage where we talk about end of life, it means that we are triaging. And this is where I think even the Director General himself has been saying we do not want to be able to arrive at a situation where we have to choose those who live or those who we could not salvage. And the reason being is the resources. We do not have the resources, or we have run out of the resources. The best example, we talk India, we talk about oxygen. Yes. Sorry.
Yeah. I'm interested that okay, I understand the resource constraints, right? And so the triage, the filtering out of people depending on whether they're going to survive or not survive. But what about the disease itself? Does the disease, manifest itself in a way that there is a point of no return for a particular individual, that it's so severe that survival is not only not likely, but the person might survive with a lot of complications for a very long time?
Yep. You are right. Because when we talk about the COVID, what is happening to somebody is not really the direct effect of the virus from the start. But what happens is the virus induces the hyperimmune response of the body to protect, but it becomes over. Hence, all the complication that can come in and cause the multi-organ failure. But you are right. Example, those who are badly affected with COVID pneumonia, who would end up with the treatment, etc. At the end of the day, their lung may not function as well. Those who come in with 80% of the lung functioning will end up, even at discharge, maybe just 10%. So these are the things that we see in not just here, globally as well. And whether it is the decision of the clinician as well with the family and everybody in terms of whether that should be led to be happen. In Malaysia, I believe we have not really, of course, the practice in terms of understanding end of life, understanding no active resuscitation, etc. is there, but the whole understanding even by the society in telling that whatever we do intervene may not be beneficial to anybody, as well as what we always would like to talk about die with dignity. Because we try, of course, resources, but at the end of the day, we are not really helping the person. Then that is also not. We are not giving justice to the patient. So these are some of the issues when we talk about end of life, when we talk about who should and who should not. It is a tough decision. We do not want to be at that stage because it's not easy. It's not that we have not done it, as in it's not a practice, because every day in ICU, even without before we came to COVID, the situation is exactly the same. It's the same for any other diseases when we have to see who should get and who should not.
Dr. Mafeitzeral, thank you so much for joining us on the show, painting a sobering picture, but one that's very necessary. Thank you for joining us on the show tonight. Appreciate your time. We're going to take a quick break here on Consider This, but more on this topic in just a couple of minutes, so stay tuned.
Ada kedepaan dan maju. Induknya adalah Melayu.
Balik kepada Islam. Orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita, sudah tentu dia akan datang daripada pemimpin wanita.
Untuk memastikan Malaysia ada kedepaan dan maju. Induknya adalah Melayu.
Balik kepada Islam. Orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita, sudah tentu dia akan datang daripada pemimpin wanita.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI sekarang.
Semua yang terjadi adalah berita, tetapi tiada siapa yang boleh bawakan yang terkini dan tergempar seperti kami.
Dilihat hanya memberi wang tanpa matlamat yang tepat.
Dia tidak melakukan apa-apa kesalahan.
Untuk mendapatkan jawapan yang bermakna, kita perlu soalan yang tepat.
Amat sedih dengan apa yang berlaku kat atas.
Tiada ruang untuk berita palsu.
Negara kita telah merekodkan kes harian baru sebanyak
hanya fakta yang diberikan.
Amat penting untuk meneruskan perjuangan negara melawan.
Hi, thanks so much for staying with Sharaad and I on Consider This. Now, although COVID-19 primarily manifests as a respiratory syndrome, its reach can extend to many other organs like the kidney, heart and brain, all with devastating consequences. Dr. Rafidah Abdullah is a consultant physician and nephrologist at Hospital Putrajaya. She joins us on the show now. Dr. Rafidah, welcome. Thank you for joining us tonight. Now, the consequences of the COVID-19 pandemic have been devastating, but there's growing evidence that suggests that patients with or at the risk of kidney disease are disproportionately affected. I'm wondering, in your line, what you've observed in the past year of this pandemic.
Okay, thank you very much. Firstly, to Astro AWANI as well as to Hospital Putrajaya for allowing me to be here tonight and be interviewed by the two of you, which is it's an honor. So basically, what as we've already been here more than a year, I can see a lot of a huge impact on my patients. Especially the patients I'm dealing with are those with comorbidities, with kidney disease. There are many issues actually. Firstly, I think although our hospitals are fully operational, but of course people are actually quite scared coming to hospital. Therefore, they tend to present quite late and they're already very ill when they come in. So that's one of the problems that we have. The other thing that we have is that when the COVID-19 gets to our patients, particularly my kidney, my dialysis patients, the statistics is against them, because 1 in 5 patients, dialysis patients who gets COVID infection will die. So 20% mortality, not only worldwide, and not only in Malaysia, but worldwide as well. The number is staggering, and the risk of getting infected if you are a dialysis patient is 100 times more than the general population. So this pandemic has taught me a lot, and the management of the patients as well is not desperately easy, because when we manage the patients, we're so used to face, we're so used to holding their hands and so on and so forth. So those are the things that we miss actually, because this is a very chronic disease, and we really need to involve the families as well. So there's so many issues, and I'm sure my patients are affected mentally as well, not just physically, mentally, because these are not well patients. They're mostly probably semi-dependent, and they need their carers as well. So maybe they're alone in the kampong. They can't come. I know the families can't visit them, and all the rest of it. It is not easy, and it has been a struggle, and until today, it continues to be a struggle. I hope it will end soon.
Dr. Rafidah, what do we understand about the disease that puts people with kidney problems at a high risk? I mean, has research shown what the connection is?
Okay, so basically, firstly, dialysis patients, firstly, they're not strong. They immunosuppressed. When they get infection, they get a bad infection. That we know. Secondly, if you look at patients who go out for dialysis, there are two types of dialysis. The dialysis that you go to a hemodialysis center where you dialyze your blood dialysis. You have to go out 3 times a week. Of course, the risk of infection is much higher than the dialysis that you do at home. So when you have to go out, in and out, you meet other people in a center, that also increases the risk of getting infection. So there are two things: higher risk, and also when you get it, your body is not strong, your infection, you just go full on. That's the reason why they get into category 5, which is 4 or 5. They really get severe disease, and with that, on top of already problematic, when they have renal disease, kidney disease, they probably have diabetes as well, hypertension, and on top of that, they've got a very bad lung infection. Then the mortality is high. That's the reason.
Dr. Rafidah, is it safe for those who have been diagnosed with kidney disease, or perhaps even at the risk of having kidney disease, is it safe for them to receive the COVID-19 vaccination?
Okay, because of the staggering statistics I've told you just now, 1 in 5 die if they're a dialysis patient. That is the reason why I think the worldwide has been recommended that our patients get the vaccine. And it is a priority, as you know, in Malaysia as well. They are in the second. They are priority. They are in the second phase. Quite a huge number of them. I understand there's still dialysis patients who have not been vaccinated, but they are the priority because of this staggering, very poor, outcome in terms of COVID-19 infection. So. And if anyone asks me which vaccine, any vaccine will be fine. All the 3 that is already been used in Malaysia, it's fine for dialysis patients. And please go for it.
Dr. Rafidah, what do you think is the level of awareness? I mean, just speaking to both your patients, their caregivers, about the necessity of being vaccinated and the risk profile, that attends to people with kidney disease, or even the people around them. I mean, what's your sense of people's awareness?
Okay, I'm fortunate because I have the support of my colleagues. I'm also the head of, we call it COVID, which is the COVID vaccination awareness in dialysis patient task force, which was advised by my Ministry of Health Nephrology Head of Services, Dato' Ong. So we've got a team of nephrologists or experts who actually have a very active Facebook, engaging patients, engaging their families, giving out information. That's to me, in my opinion, in my center, the ones that I look after, they've been excellent. They have accepted the vaccination. Literally in my hospital, which I work now, Hospital Putrajaya, 100% of them accepted and very keen to get vaccinated. And the other thing as well, I have a wonderful colleagues who does general activities on busting myth, giving out facts, which is our NGO, MedTweetMy. I think they are excellent. We try and get as many people, as much awareness as possible. Of course, we need to target, the ones who wants the vaccination is fine. Those hesitant, we call it vaccine hesitance, are the ones who we're targeting. I think we've lined up many public programs, and we'll be engaging doing a lot more program, engaging the public as a whole. I think I'm very fortunate that everybody is online, and I can't do it alone. They can't do it alone. We have to do it together. That's the most important thing. I urge everybody to do even a simple small thing. It will help the vaccination awareness and so on and so forth.
Can I ask you, Dr. Rafidah, just to elaborate a little bit on that? When it comes to building that confidence in vaccines and using the communication, there are multiple, types of communication. We've seen everyone saying, well, you've got to address the vaccine hesitancy. But how do we do that? What kind of approaches work? Are we looking at scare tactics? Do we put the fear of the disease into people, or do we use fear of missing out? What kind of approaches do we take when communicating the importance of getting vaccinated?
I cannot answer for the whole population, but what I experience, I'm all for shared decision, informed decision. So every single decision I will discuss with my patient. So I put out those statistics and just facts. And most of them accept it and they just keen for it. So I believe, I'm sure there are multiple statistics, but I'm not a believer of fear-mongering and all that sort of. I think our population, especially the younger ones, they're open to facts and they're open for discussion. But we need to be engaged with them. We need to engage them as well. So, there is a lot of work to be done, actually. And I hope everybody will help us in doing that.
Dr. Rafidah, we've had a year of this pandemic, and the earlier efforts to flatten the curve were about building capacity, along with protecting the vulnerable. Do you think we've done enough in the last year to achieve those two objectives, building capacity and protecting the vulnerable?
Well, I in general, I can only comment what I see in my practice. I obviously cannot comment on the whole program as a whole, but of course we have done the best we can. I think Ministry of Health has been excellent, and the vaccination program has been ongoing. I think it's over the last 24 hours there have been activities showing that the increased all sorts of programs to reach the public. I think we have done quite a bit, and I'm sure everybody agree we can all do more. I hope that will happen in the next. Everybody will be helping us, I hope. Thank you.
Yeah, the Director General of Health talked today about a possibility of a vertical surge in the epidemiological curve, and I'm wondering what you are seeing in your daily work. Are we doing enough to stem this unavoidable wave or so-called unavoidable wave?
Okay, so I think we have predicted this for quite some time. I work in a hospital where I receive probably category 4 and 5, quite advanced patients who come to our door, and that's where I work in. So I'm fortunate in Hospital Putrajaya. We have a dedicated team to manage the patients that come in. Therefore, I am not really involved in the public health, but I'm sure I can see they're doing a lot. And again, as I mentioned just now, we can also do a lot more.
All right. Dr. Rafidah, thank you so much for speaking to us on the show tonight. I really do appreciate your time and you sharing your insights with us. Thank you.
Thank you so much for inviting.
That's all we have for you on this episode of Consider This. But before we leave you, as always, a reminder that you can get all the latest news on COVID-19 as well as information on COVID-19 vaccines at astroawani.com and the Astro AWANI app. But thank you so much for watching the show tonight. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
We'll be back with you same time tomorrow. Till then, good night.